Good morning, all of you. So this is the work done by the research group of IIT Mandi, Dr. Anirban, Sarkar, and G. Srikant Reddy. So they are not available, so I'm just presenting their work on their behalf. So if any questions are there, so I will, if there are some in-depth questions are there, we will communicate with the authors. So this the work is again it's microwave based technique. So the basic idea of work is same, as the dielectric constant is going to be changed, for the normal skin and heart and muscle abnormality detection. So the work is again for the abnormality detection. So once the dielectric property is changed, so there will be change in the reflection coefficient of antenna. So the primary idea is that, and the authors have designed a tri-band antenna for detecting this abnormality. So these are the outline of the work. So here, the introduction here, so cardiovascular disease. This is the primary that comes under the heart abnormality. Then skin abnormality, it happens for during inflammation, burns, and skin cancer. And skeleton muscle abnormality is also there. So that happens when there is a decline of muscle and encompassing prolonged phase of immobility, adequate nutritional uptake, or severe burns. So they have designed antenna, which is a EM sensor for detecting all these three, heart abnormality, skin abnormality, and skeleton muscle abnormality. So this sensor that is designed on a FR4 substrate of thickness 0.5 mm, and this is a tri-band antenna which having the resonance frequency at 2.72, 5.33, and 7.76 gigahertz. And the abnormality test have been conducted with the varying the dielectric constant at these three frequencies. So this is the schematic of antenna. So they have used the microstrip line to at port 1 and 2, and this port 1. They have used the microstrip line at port 1. So the justification of using this structure is that this Fern structure is going to confine the field within a designated region which provide a sensitivity level. So the tissue dielectric constant undergoes alteration, and this result in the shift in the observed resonance frequency. So this is the reflection coefficient. It's having the three three resonances. EM sensor field configuration is basically disrupted due to dielectric change in the tissue. So these are the basically the three modes of the sensor, and the red portion this is the electric field distribution. And the red portion is basically noting the high strength of electric field, and which also determine the sensitivity. So now this the tri-band antenna is tested with a phantom model. So this these are the different layers of phantom, which is mimicking the exact scenario of a human body. So that's the heart muscle, then bone, skeleton muscle, fat, skin. So they have a dielectric constant, different dielectric constants. So now if the dielectric constant of this heart muscle is changed from 35 to 42, so we can see this shift in the reflection there is change in the reflection coefficient at 5.33 gigahertz, and this like when we are changing from 35 to like varying the permittivity from 35 to 38 at 5.33 gigahertz, so there is a magnitude shift of 0.9 dB and amplitude shift of 2.4 at of 2.4 dB transitioning like there is an amplitude shift of 2.4 dB. And the other resonant frequency like at 2.72 and 7.76, they are like these two frequencies are basically stable, and there is a effect only at this middle frequency like 5.33 gigahertz with the heart deformity like case 1. Now if we take the skin deformity, then the changes is observed only at the lowest frequency, that is at 2.72 gigahertz, but the other two frequencies are stable. So they are like changing the like dielectric from 40 to 45 for the skin, and there is a change in only in the lowest frequency, that is 2.72 gigahertz. Now for third case, that is the skeleton deformity. So when they are changing the dielectric constant from 35 to 60, so there is the major changes at the uppermost frequency, that is at 7.76. So the claim is that like all these three frequencies are independent, and for each deformity, like one of the resonance frequencies responsible for that, like change in the like magnitude and a shift in the frequency at one of the band can be used to identify the deformity. So and again like since the sensor has been designed on FR4, so it's like low cost technique, and the other advantages of microwave based sensing like invasive and all those things is also available in this technique. So structure can like they have fabricated a structure, but I don't think they have done the measurement with the real phantom model. So thank you. If there are any question, then.